Hello, welcome ladies and gentlemen to today's tutorial. Today we are going to look at the common carotid artery. Now remember that the common carotid arteries are two. We have the right and left, and they are going to be the main elastic artery which are going to actually supply the head and neck areas. Now what happens is that yes, apart from supplying it, they will also be important in checking the pulsations of a patient. Apart from this, what happens is that yes, we'll have what we call baroreceptors for actually checking the blood pressure, regulating the blood pressure. Apart from this, as you tell with it, we also have what we call chemoreceptors, trying to check sensing the oxygen content in blood, and therefore helping in either hyperventilation and of course hypoventilation. In other words, regulating the depth and rate of breathing. Yes, this common carotid artery, we have two of them. We have the left common carotid artery, which arises directly from the arch of aorta at the level of T4 vertebral level, to actually supply the left portion of the head and neck area. And of course, for the right portion of the head and neck area, they will get will indirectly come from what we call branch of what we call the arch of aorta, being the brachiocephalic artery or the brachiocephalic trunk, giving rise to this right common carotid artery. Now, one thing is that because of course the left one emerges earlier than the right one, then it tells us that the left one will have more of its part to be in the thoracic region compared to the right aspect. So what we know is that at the level of the sternoclavicular joint posterior to it, that is where the brachiocephalic trunk will divide into two. Remember that actually the arch of aorta will actually give off three main branches. As continuation of the ascending aorta, the arch of aorta is going to give three main branches, and these three main branches are the BSC branches, okay, or the BSC arteries, which B. So from right, we are going to have the brachiocephalic trunk, which will give off the right common subclavian, the right subclavian, and of course the right common carotid arteries. Then we also have what we call C. The C is going to be the common carotid. Okay, the common carotid will be in the middle. Okay, actually the left common carotid artery. Then of course we also have what we call the S. The S being what we call the left subclavian artery. So these are how they are actually going to be arise. So remember that the artery in most of its course will be in what we call, yes, it's going to be in the carotid sheath. It's not going to be the only one in the carotid sheath, but it will be there together with the internal carotid artery. So remember that at the level of the superior border of the thyroid cartilage, the common carotid artery will actually divide, bifurcate, to give rise to what we call the external carotid, and of course the internal carotid. The internal carotid will actually supply most of the structures which are in the brain, actually in the cranial cavity. Then external to it will be supplied by what we call the external carotid artery. So without much ado, yes, let's begin our journey looking at the external carotid artery. I was talking about the carotid sheath, which is very important. Apart from the common carotid, the internal carotid, yes, of course, the internal jugular vein, as well as the vagus nerve will be content of what we call the carotid sheath. So let's begin our journey looking at this. Now, so as I indicated, so this is the right aspect. This joint over here, this is the mandible of the sternum, and this is the the medial end of the clavicle. So the sternoclavicular joint over here, posterior to it, that's where the right common carotid artery will actually arise from division of what we call the brachiocephalic trunk. So let's look at the course. Now generally what will happen is that we will have so one thing is that yes, as I indicated, the right common carotid artery will arise behind the brachiocephalic division from brachiocephalic trunk at the posterior aspect of the sternoclavicular joint, as we've said. Now but the left one, which is over here, this model did not really show it very well. So this is the left one. will actually arise directly from the arch of aorta. Okay, the arch of aorta will arise directly as the left, common carotid artery. Okay, so that is one thing that we find. Now, so what will happen is that they ascend. Okay, both of them will ascend, superiorly in the neck region upwards, but actually they will go actually lateral to what we call the trachea and of course the esophagus. So I will look at the relations of these ones and you will get to see. Now, as I said, at the superior border, okay, over here of the thyroid cartilage, there's a thyroid cartilage. We are going to have what we call the division of the common carotid artery into left and right common carotid arteries. But remember that what happens is that yes, this superior border of the thyroid cartilage is also related to the C4 vertebral level. C4 vertebral level. So that marks what we call the division of this external. What we call the common carotid artery. Now remember that we've done actually the triangles of the neck. We saw that one of the triangles of the anterior triangle, sub-triangles of the anterior triangle, was the carotid triangle, which will contain, the common carotid as well as, of course, the internal carotid. Now remember, please visit that video to get more insight in that. Okay, so that's the area that we find. So we will actually enter what we call the carotid triangle. Okay, this is the area of the carotid triangle. This area, that's the carotid triangle. So over here, now one thing is that one important thing that we have to explain is that this artery, just before it bifurcates, you can see some kind of dilatation. It dilates over here. Now this dilatation, yes, it may not be only here. Sometimes too, it may dilate at this one over here, which we call it the internal carotid artery. This is the internal carotid artery, and this is the external carotid artery. You can see its branches going to supply the external aspect of the head and neck area. So this is the internal. Now over here, it tends to dilate. Sometimes to the internal, just after emerging from the common carotid, also has some kind of dilatation. Now these dilatations are known as carotid sinuses, or we call it carotid sinus if it's one, carotid sinus. And this is very important in the regulation, actual detection of blood pressure, as well as regulating the blood pressure. Why? Because this carotid sinus contains what we call baroreceptors. Now these baroreceptors, okay, will be sensations, okay, will be conveyed via what we call the glossopharyngeal nerve, okay, to what we call the brain to help in regulation of the blood pressure. So that's one thing about it. But so it means that again we said that we can feel the pulsations of the patient here. Now an important thing is that there are some individuals whose baroreceptors are very sensitive, and they go to the extent that they are sensitive to stretch. So once the fingers touch the area, then what will happen is that it will actually lead to what we call slowing or reduction of the blood pressure. So whenever there's external pressure, okay, such as putting your fingers, at the area where we have the carotid sinus, it will cause reduction in blood pressure. Slowing of actually the heart rate, and of course, blood pressure will go down. Now, because of this, then what will happen is that if blood pressure goes down, now importantly, the brain needs a lot of perfusion. Oxygen-rich blood will have to, get to the brain. If that happens, then the patient will go into a state of, unconsciousness, which, you can also refer to it as syncope. Okay, so that one will happen, and as a result, if any patient whose baroreceptors, which is in the carotid sinus, is too sensitive, then it is advised that we don't take pulse around this area. Okay, because they are, the baroreceptors over here are too sensitive and very sensitive to stretch. Whenever you touch it, then that one will happen, reducing actually the blood pressure. Okay, so it is not advised to actually take the pulse in the carotid triangle over here, where we have what we call the carotid sinus. Okay, so that's one thing. Now again, outside this carotid sinus, we also have what we call some kind of carotid body. Now this carotid body consists of a cluster, so a number of nerve cells. Okay, nerve cells will actually cluster, and they are actually they act as what we call peripheral chemoreceptors. And these peripheral chemoreceptors will be very relevant in the detection of the level of oxygen in blood. So once they know that the oxygen level, okay, where is going to be supplied to various organs, including, of course, the brain, then what will happen is that it will trigger, of course, send the message to the brain to either trigger what we call hypoventilation or hyperventilation. Now, if there is less oxygen in there, then it means there's a lot of carbon dioxide in there. Therefore, there will be triggering what we call hyperventilation to get rid of a lot of carbon dioxide, rich air. Then, if the opposite, where we have enough oxygen, then what happens? There is no need for ventilation. Therefore, there will be normal ventilation or even hypoventilation. But usually, there will be normal ventilation. So that's what is going to happen. Now, so one thing that we have to know is that having seen this, so essentially, that is one thing that we have to know, okay, about this, common carotid artery. Very important that we know. Now, the arteries, we have a lot of them, so we'll be taking them one after the other, bit in bits, so that we can actually learn the clinical applications of them. Now, what are the relations that this, common carotid artery, has? So importantly, what will happen is that we are going to talk about the anterior relations. Now, for the anterior relations, now look at this muscle. This is the superior belly of omohyoid, the inferior belly. Now, look at it. Now, over here, we don't have such a structure here, but what happens is that the superior belly of omohyoid muscle crosses the common carotid, artery anteriorly. Okay, so it crosses it anteriorly. Usually at the level of the C6 level where we have the cricoid cartilage. Now again, we can see this muscle, this large muscle over here, which is known as the sternocleidomastoid muscle. It also crosses it anteriorly. Yes, apart from this, we also have what we call the anterior jugular vein. Okay, we also cross it anteriorly, which is not shown here. The anterior jugular vein also crosses anteriorly. Apart from that, we also talk about the middle thyroid vein as well. Okay, which is also not here, but the middle thyroid vein will also cross it, anteriorly. But importantly, with the ones we can see over here will be the stenothyroid. Okay, now look at this muscle. So from the hyoid bone to the sternum, so the sternum, the mandible of the sternum will be here. So the stenothyroid muscle. Apart from that, we also be related to what we call the stenothyroid muscle. Stenothyroid muscle, deep to the hyoid muscle will be stenothyroid muscle. Okay, it will also relate to it anteriorly. Now, for the posterior relations, we are going to have what we call the transverse processes. Actually, the transverse processes of what we call C4 to what we call C7. So the transverse processes. Okay, so these represent actually the transverse processes. Now, this is going to be C4, C5, C6, and C7. The transverse process of C4, C5, and C7 will be related to it, this time around posteriorly. Now, apart from that, there are some muscles which will actually take, attachment on what we call the scalene tubercle of C6. Okay, so the scalene tubercle of C6. Now, so this is the 4th, 5th, 6th, okay, scalene tubercle of C6, okay, we take attachment from them. These muscles are what you call, longus coeli and of course longus capitis, muscles. Then again, they will also be related posteriorly to what we call the anterior scalene muscle or the scalenus anterior muscle, okay, muscle posteriorly. So this one will be the posterior relations. But one other thing too is that we also have an artery which is the inferior thyroid artery, which is not shown here. But this inferior thyroid artery will actually emerge from what we call this the thyrocervical trunk. Okay, and it will run what we call posterior medially, so it will be related to it posteriorly. Okay, now one other thing too that we find is that we also have what we call now we will have what we call now in the cervical vertebrae, we have what we call transverse foramina or foramen transversarum. will be in there, where you have, you know, the vertebral artery actually running through. Now this vertebral artery will not go through what we call C7, okay, will not go through C7. So what happens is that on the left, okay, on the left side, okay, the thoracic duct crosses, you know, lateral posterior to what we call the vertebral artery, you know, at posterior to the artery, you know, actually at the level of a what do you call it, C7, okay. But remember that the vertebral artery, okay, will also relate to it, you know, posteriorly. So that's one thing that we find, vertebral artery relating to it posteriorly. Then on the left, okay, left side, okay, this time vertebral artery on both left and right, but on the left side, what will happen is that we have what we call the, posterior to it, we also have what we call the thoracic duct. So that's one thing that we have to know. Then, of course, the next one will be the medial relations. Okay, let me just even talk about the lateral relations. Now for lateral relations, it's pretty simple. We are going to have what we call the internal jugular vein, okay, this which will be lateral to the common carotid artery, okay, lateral to it, internal jugular vein. Then apart from that, we also have what we call vagus nerve. Now I told you that vagus nerve will also be a content of the carotid sheath, so it will also relate to it, you know, laterally. Okay, yeah. So that is one thing. Now the next thing that we have to, you know will be the medial relations. Now for the medial relations, you know, some of them are here. We are going to have what we call the thyroid, you know, gland. Okay, so medial relations, we will find actually the thyroid gland, because this is the artery, so medial to it we have the thyroid gland. Okay, then apart from thyroid gland, we also have what we call the pharynx. Okay, the pharynx will also be related to it. Okay, this is your truth, your pharynx will be related to it actually medially. Then beneath that we have what we call the larynx, related to it medially again. Yes, of course, we talk about, you know, the trachea. Okay, then the trachea, of course, you know, the trachea, posterior to the trachea we have the esophagus. Okay, so the esophagus will be here, okay, relating to it, you know, actually posterior medially to what we call the common carotid artery. Then apart from that, you know, we have what we call the recurrent, you know, laryngeal nerve. Of course, when we look at, you know, especially when we look at, you know, the subclavian, you know, artery, we look at, you know, the recurrent, you know, laryngeal nerve. So, ladies and gentlemen, I hope it's going to be helpful. Now we look at the remaining branches of, you know, we look at the external, of course, you know, the internal in our later sections. Thank you very much for your audience, and may God richly bless you.